Hi, my name is Kelsey Wortman. I'm a nurse practitioner student through Maryville University. I'm going to go ahead and do an abdominal assessment today. This is my patient. She's volunteered to go ahead and do this assessment with me. So first off, what we would do is go ahead and inspect her abdomen. First off in the back, it is a little rounded, but it's symmetrical. You don't notice any obvious bulges or nodules or anything. You don't see any type of herniation or pulsations. You don't see any enlarged veins. Go ahead and just lift her head up here a little bit. Very good, just rest back. I don't notice any bulges when she's doing that, a sign of like an umbilical hernia or anything. I would then go ahead and auscultate her 4 quadrants. You would auscultate for a minute to hear bowel sounds. She had normal active bowel sounds in all 4 quadrants. You would listen, like I said, for a minute. If you were not hearing any bowel sounds, you would listen in each quadrant for 5 minutes. If you still didn't hear anything, then you would consider that patient to have absent bowel sounds. Now I will go ahead and listen to just the different arteries around her abdomen to listen for bruits or anything like that. So I'll start with the aorta. We'll go renal veins, iliac, and then femoral. Okay. I don't hear any abnormal pulsations or noises, no bruits going on in any of her vasculature in her abdomen. I would then go ahead and percuss all of her quadrants. I hear tympany in all 4 quadrants, which is a normal finding. I would then go ahead and percuss the liver. You would go mid-clavicular line here. You would be listening for dullness, would be the liver. All right, so it goes about there, go down. Okay, and then go out. All right, so I percussed the size of her liver and it is within a normal range. I would then go ahead and percuss her spleen. You just do the same process. Okay, percuss her spleen as well, that is within a normal limit. And then lastly, percuss her gastric bubble here. All right. And then we would go ahead and move on into the palpation portion. Palpate all 4 of her quadrants here. Is there any pain when you feel me pushing on you? No. Okay. I don't feel any herniation or nodules or anything. I don't feel any abnormal pulsation. She wasn't having any pain or tenderness while I was touching. I would then do a deeper palpation of all 4 quadrants. Try and feel for any pain or anything. No? Okay. And then I would go ahead and palpate her liver over here. Is there any pain when you feel me pushing? Okay. There's no hepatomegaly over here. There's no tenderness. It doesn't seem swollen or inflamed. That is all normal. Sometimes you're able to palpate a person's gallbladder if they haven't had it taken out. I cannot feel hers though, but that's still normal. Then move over and try to palpate her spleen over here. Have you ever had your spleen taken out?
No.
Okay. I'm not able to palpate her spleen, but that is normal. It would be an abnormal sign if you were able to feel it. It would probably show signs of some kind of infection, like maybe mononucleosis or something like that. I would then go ahead and try to palpate her kidneys here. Is there any pain when I'm pushing here?
No.
All right. Do the same thing from the other side. All right, no pain again. Those are within a normal limit. Palpate her abdominal aorta here. I don't feel any abnormal pulsations going on or anything like that. I would feel her umbilicus here. I don't feel any signs of herniation, no bulging. There's no tenderness down here. Is there any tenderness when I push over on your side here? Mm-hmm. Okay, that's good. If she was feeling pain down here, it could be signs of like a appendicitis or something like that. And then the last thing I will do is I will have you sit up here and I'm gonna test for CVA tenderness. You have any pain when I'm touching back here?
No.
All right, so she doesn't have any pain in her back when I'm doing that, which is good. That's normal. If she was having pain back there, it could be a sign of some kind of kidney infection or something going on with her kidneys. So that was all normal findings. And that is the end of my exam. Thank you very much.